Reec. The homie Reec. You already know, man. It's Taylor Gang. I die.
Who you with?
Reec.
Yeah. Who you with?
Who you with?
That means it's time to do some radio, baby. Some visual radio, a.k.a. a TalkCast Reec Show Live, coming at you with some good action today. You know, we always try to bring you a little wellness. We didn't do a Wellness Wednesday. We're doing a Wellness Thursday. So, of course, we had to get one of the relative experts from the ankles down. No, I was playing. This man knows how to make sure that you're right, but he will make sure that your feet are in order. Let's welcome to the stage, the big stage, Dr. Alvin Jeffrey Cowans II, DPM. Let me not forget those letters, too, man. I always wonder, what all the letters mean behind doctors' names. I get to Googling in the office to make sure, if I'm there for my knees, make sure they don't do back. But we got you here, man. Introduced to you from a good friend of ours, Mike Record, and we wanted to get you on because, as a former athlete, I'm about to say athlete. Now, I don't qualify for that anymore. I was a former athlete. I had some foot issues, and I know a lot of people who probably had the same thing. And you're kind of a relative expert in the area, but so to welcome you to the stage, obviously you're of Wellstar, Douglasville Wound Care, and you're also of Optimum Pediatry. Make sure I said it right. Pediatry.
Yep.
That's the feet. All right,
That's
so
correct.
let's kind of talk to you a little bit about that, man. How did you get introduced into medicine in the first place?
So the way I got introduced into medicine, when I was a little kid, my mom had a lot of foot issues going on. My mom had bunion, hammertoe issues, a lot of foot ailments or so. And so when she used to go see the foot doctor, the podiatrist, she used to drag me right along with her. So it was shocking to me as I got older, as an older kid, that nobody really knew what a podiatrist was. I was like, really? I go with my mom all the time to the podiatrist. He's giving her orthotics, doing procedures, and I have to help her. Every time we go home, I have to help with bandages or you name it. I had to help as a little kid. So I was exposed when I was really young. And so when I got older, I was like, hey, I'm familiar with it. This is my way into medicine. And then as I got into college, I shadowed the podiatrist that was seeing my mom. I shadowed him surgery, surgery. And so I was well-versed in podiatry before I even went to medical school.
That's a real life introduction. I learned early too because my dad had what they call bunions, so I had to go with him to the podiatrist, and I was like, "What's this?" The first time we went, and then I figured out it was a foot doctor, and got introduced to it that way too. It didn't take me in that direction though, but that's awesome to know that you have a personal story to see. Okay, I found out about this, nobody knew about this, and now I want to get into this.
That's
All
right.
right, I've been scared of feet my whole life. So
It's not bad.
I got you. So as you get to learning this, what part fascinated you the most?
So the part that fascinated me about podiatry is that I work with any type of patient, from the high-powered professional athlete, from an NBA player, college player, all the way to newborn babies. Everybody has some sort of foot issue or something that has to be either corrected or some type of prevention needed to prevent some foot issues or ankle issues in the future. So that I can see any type of patient and I can talk to anybody, and it's just rewarding because everybody at some point in their life is going to need foot care or some foot treatment or prevention to prevent any future issues.
Absolutely. Right now, if you're just tuning in on the radio side, we got Dr. Alvin Jeffrey Cowans, the second DPM. We're talking feet, everything feet right now. You're right, though. That's a great point because, like I said, I was with my father. He had a foot issue. One of my daughters has a foot issue. She has flat feet. It was preventing her from running track. So she had to get special insoles and stuff like that. Now, you said when you went with your mom, she had hammer toe. I always thought that was like a slang phrase for big toes or something like that. What in the world is that in real life?
So hammer toe is a condition where the toes, the second, the third, fourth, other than the big toe, start to curl up, and and the toes start to curl underneath each other or cross over to the other toes. And this is a genetic condition that's passed on from the mother or the father to you. So you could be barefoot all your life and still develop this hammer toe condition. And so what happens is a lot of times patients develop pain in these hammer toes, the curling toes as I call them, because the shoe wear that we have starts to rub up against the top of the curling toes, causing corns and causing pain from that way. And also when the toes start to curl over a long period of time, you start to develop arthritis in these hammer toes because they're not naturally supposed to be curled. They're supposed to be straight. And so when they curl, the bones start to rub together, eroding the cartilage in the toes, causing pain and causing arthritis in the toes.
Gotcha. How do you fix that?
So the way to fix it, I know a lot of people say you got to break the bone or so. But a lot of people say that, but the way to fix these hammer toes is you have to remove a portion of the bone of the toe, and then you got to make the toe straight and hold it straight with a wire or a screw or a pin, and you hold it straight, and it's supposed to hold it straight for the rest of your life. The toe's never supposed to bend again. That's how you fix the hammer toe, because it's genetic. So if you were to kind of cut the toe and just try to make it straight without pinning it or putting a wire, the hammer toe condition will come right back.
Right, it's because it's going to correct itself to
hold it straight for the rest of your life.
Got you, and that makes it makes it less painful for you and a better quality of life.
That's correct. Yes, and also you can wear any type of shoes once your toes when your toes are straight.
Yeah,
all shoes are possible at that point.
All shoes, I like that. All shoes are possible. You can have those toes out now.
Exactly.
I like it, man. Right now we're talking to the good doctor about toes, really, and pediatry. Before we get into the other part, because I do want to talk about the wound care and stuff like that, but let's also talk about some of the common things that people may not know they're dealing with the issue, but they are dealing with the issue.
Right. So a lot of time, the most common thing that I see, patients always come into my office. The main one is my heels are hurting. Patients always talk about my heels are hurting, and I don't know why. They just came out of nowhere. I never rolled my ankle. I never landed hard. What's going on? And so a lot of times I tell them the issue is called plantar fasciitis. That is probably the main issue that I see all the time. And a lot of people think it's just due to flat feet. And I tell them, like, flat feet is a part of it, but not the whole reason. So the reason a lot of people have a lot of heel pain is a ligament on the bottom of your foot called the plantar fascia. It just doesn't attach to your heel. It attaches to the Achilles tendon. And so what happens is when you're out and about, you put on a lot of weight, you're walking, you're working for 12 hours a day, the Achilles tendon gets tight, and in turn, the plantar fascia on the bottom of your foot gets tight. And so what happens is that tightness, you're getting a lot of tearing at the bottom of your heel, which is the cause of plantar fasciitis. A flat foot makes the plantar fascia tighter. So you have more tearing and more pain. And also, if you don't get this treated, it leads to other issues. It can lead to people walking on the side of their foot, causing stress fractures on the side of their foot, causing tendonitis on the side of their foot, causing also Achilles tendonitis because you're not stretching the Achilles tendon, you're not wearing proper shoes. So this condition leads to a lot of many other conditions dealing with the foot. So when you have heel pain or the back of your heel hurts, just don't try to let it go. Come see the podiatrist because it'll lead to other foot conditions.
Got you. That makes plenty of sense. Let me hit the hype bell on that because I know it's a lot of people right now tuned in. They're like, oh, that's what that is. I need to go see the doctor right now. Right. I get it. So do things like those doctor shows and those insoles, do they help or hurt more when you're dealing with certain foot issues or your foot might be hurting a little bit? Obviously, they need to see the doctor, but do those quick fixes help at all?
So they may provide some mild temporary relief in the symptoms of the, let's say, foot deformities or heel pain. But what the Dr. Scholl's orthotic offers, it just offers extra cushion. So it's not giving support that the heels needed. It's not giving support that the midfoot needed. It's a ball of cushion. You can take the Dr. Scholl's orthotic and you can fold it up in a towel. You can wring it like a towel. You can do all things for it. So it's giving you the cushion, but it's not giving you the support. So what you need is an orthotic that gives you the cushion of Dr. Scholl's, but it gives you the support that maintains your foot with a normal arch and also a normal pressure to the balls of your foot into the heel of your foot. So you need a combination of support and cushion. Dr. Scholl doesn't give the support part.
That makes plenty of sense to me. Let's clear up some common misconceptions because we know more men are getting into, health and different things and taking care of their body a little bit better. And you see more men like putting stuff up. They're getting pedicures and stuff. Is that shit something that you recommend men getting, more pedicures and things like that? Or what are some common practices we should do on an everyday basis to keep our feet healthy?
So I don't mind pedicures in men. It's good that men start taking care of their feet, start looking at their feet. Because a lot of times I see a lot of men neglecting their feet. And by the time they're getting to their 50s and 60s later in their career, they start having foot issues and they're not able to fully work. So it's really good for men to start doing pedicures, to start taking care of their feet. However, if you're a diabetic patient or you have diabetes, I don't recommend going to getting a pedicure, because when you have diabetes, your immune system doesn't work like a healthy individual. So it's real easy to get a toe infection or toenail infection from going to get a pedicure. So it's best to go see a specialist like myself, a podiatrist, a foot doctor, that will take care of your toes or foot instead of a pedicure if you have issues like diabetes or peripheral vascular disease. So that's number one. That's very important. The next thing is, it's good to be, as a man, to be checking your feet daily, getting like a mirror or so, putting it on the floor, checking the bottoms of your foot, in between your feet, on top of your feet, just giving a normal inspection like you do when you're taking a shower or so, because you could be developing issues like teniapedes, which is foot fungus. If you don't treat that, foot fungus can lead to other issues like ulcerations if you have diabetes, or if you don't have diabetes, it can still lead to stuff like that. It's good to be checking your toenails, because if you're not checking your toenails, you can develop toenail fungus and other things like that that can lead to like ingrown toenails. When you have an ingrown toenail, that's when the nail starts curling into the skin, and that can lead to infection, which could eventually possibly lead into a toe amputation. So it's always good to be checking the feet on a regular basis, making sure there's no cancerous lesions popping up. You can see melanoma in the skin. You can see squamous cell carcinoma, which is another form of cancer in the foot. A lot of times pop up in the foot before you see it elsewhere in the body. So it's really good to check your feet. You can prevent a lot of future ailments and future issues if you're checking it on a daily basis.
With those things that you just named, what are we looking for? Discoloration, lumps, bumps, lesions? What are we looking for?
So a lot of times when it comes to specifically like cancers or lesions, you're looking to see, you're looking at the bumps. Let's say it's you're looking to make sure that the color is uniform. Let's say it's black color. You don't want the bump to be black and purple and white and red. That's there's a possible cancer forming in that bump area. So you want to check to see if there's a non-uniform color of that bump. You want to check to see if that bump is raised or if it's flat. Those are things that can give you some concern. Also, you want to check to see if do you have a rash forming on the bottom of your foot to the medial side of the foot or in between the toes or to the balls of the foot. If that's the case, you're developing a severe form of what we call foot fungus or teniapedes. That's something that needs to be treated because that can also spread to elsewhere on the body. So those are some things you want to check on your feet. And if you see these things, I don't recommend going to CVS and trying to apply certain creams that you heard your grandmother said that you should try.
Right.
It's always important to go get a specialist to take a look at it because you never know what it is. Even a lot of patients look on Google to see what it is. And what happens is Google doesn't lead them down the wrong path and they end up not being able to treat the condition. So if you see these type of issues, type of lesions or bumps or rashes forming, come to the specialist early because we can treat it early where it leads to no more problems in the future.
You've paid thousands of dollars to get this education. Go to the person that did that. Don't take a 5-minute Google dive and think you know how to treat this situation.
Oh, exactly. I did. Actually, I was in med school for 6 years. I got a master's while I was in med school. And then I did 3 years of surgical training. So I was trained up and down for these type of issues. So
Don't be in there putting potatoes in your socks at night thinking you clearing something up. It's not going to work.
It's not going to work.
No, we appreciate that information.
A lot of patients, a lot of times when they have little ailments on their foot, they like to put peroxide on the foot. That's a common thing I see here. And so I try to educate patients, don't do that. Come see the podiatrist because peroxide will make the condition worse. A lot of patients put alcohol on the foot. Don't do that. That will make the condition worse. So that's why it's best to come see the podiatrist because we have different ointments and creams and you name it to help treat every certain condition that may arise in the foot.
Right. Man, that's some great information. I want to ask one more foot question before we get to our next line of questioning. most common thing around where we hear people with feet is they stub their toe, they bump their toe on something. Ouch, it's painful, it hurts. At what point do we need to go to the doctor or podiatrist if we stub our toe? What is that one of those ones like something's really wrong? It's not just a regular pain.
So if you notice that the toe is that you stubbed is kind of drifting to the side, it's not sitting straight. If it's drifting over top of another toe, that's a sign that you've damaged that toe pretty badly. So that means you need to come in to see a specialist right away. Another thing is if you notice the toe really turning purplish, turning reddish purplish, or the size of the toe is swollen so much that it's the size of two toes. That's a sign that something has been damaged and you need to come in and see the doctor right away. Now, if you stub the toe and you have a little bit of pain and you don't really see any changes going on with the toe, then it's not, you can buddy splint the toe to the other toe and you'll be okay. But if you're seeing visual signs of the severe bruising and swelling, as well as the toe drifting, then you probably need to come in to see the doctor because you may need some type of procedure or something for the doctor to do to make sure this toe heals correctly.
Man, you nickname you foot action, man. You really know this foot stuff. I like it. Let's kind of talk about wound care because you're in the wound care division over at Wellstar. What does that encompass? I want to know more about this.
So a lot of the motto when I was trained is save a limb, save a life. A lot of times when these patients have wounds, if you don't treat them in a very quick manner, these wounds can get infected. And these infections lead to amputations. And so a lot of patients don't know is when you start getting leg amputations or so, it shortens the quality of your life. It shortens your life. So typically, if you have an amputation of one leg, within 5 years, most patients get an amputation of the other leg. Wow. And then when you have an amputation of both legs, most people pass away within 1 to 5 years. So wound care is so essential to prevent these amputations and prevent these infections. So with wound care, when I'm at the Wellstar Douglas, I see all types of wounds on the bottom of the leg. Diabetic wounds. Another one is called peripheral vascular wounds, or wounds because patients are not getting enough blood flow to the legs. I see wounds from trauma due to car accidents, due to athletic injuries, due to trip and falls. I see those, and I also see wounds due to cancerous lesions. From sometimes when you take out a cancerous lesion, it leads to a wound because there's been cancer in that area. So I have to treat those to get those to close as soon as possible. Because if you leave them open, you're not getting professional help, you will get an infection in that wound pretty quickly. So that's why I'm in there to prevent these patients from losing their legs, which will in turn prevent them from losing their life.
Great information once again. So I need anybody listening, you know, a family member or yourself, you got a wound, you got an open cut or sore or something, and you think it's minor, it's not bothering you that much. It could turn into something serious.
Mm-hmm. Yes.
And good info. Good info. And if in the Douglas area, they need to come see you.
Yes, right. If you have in the Douglas area and you have wounds, definitely. Or if you're not there, we set patients from all over the Atlanta area. We have patients even transferred to us from other major hospitals or so.
Wow.
Yeah.
Man, that's pretty cool. How did you get moved into that line of treatment? Is it something that was just a need that needed to be filled, or you saw some things and you were like, you know what, I need to make a mark in this part of it? So
it's interesting. When I got into the podiatry field, I actually didn't want to do wounds. I was like, man, that's gross. That's nasty.
I don't blame you.
Deal with that. But in my surgical residency training down in Miami, it was Mercy Hospital in Miami. They have a very large wound care center and hyperbaric center for treating wounds. So part of my training was being in the clinic, being in the wound care center, then surgery. So I had 3 years of very intense wound care training. And so I learned the importance of that podiatry and wound care go hand in hand. It's very important to be able to treat wounds, because if you look at our population has become more obese, more diabetic, and they're not taking care of themselves as much. And so which is leading in turn to more people having wounds. So if I treat these wounds and I get patients healed, they also become patients for life. So it's probably one of the most important needs in our field, because when you save a person's leg, you treat their wound, you save their life.
Wow.
So it was very important for me to do this. Even if I like it or not, it's important for me to do because it's important to save the lives of the patients.
Well, duty calls and you're good at it. I know you're an award-winning doctor, so we can't take that away from you. We appreciate what you're doing for the people and for the community because you kind of roped in, even though you said it wasn't my initial interest, but I need to be here.
Yes, exactly.
Absolutely. What are some things that people can do because like you said, we have obesity problems, we have this and that will adversely affect our feet and these wounds and things like that. What are some everyday things people can do to kind of get some preemptive health care?
So the best, one of the two best thing is diet and being active. Okay. So I always recommend that people should be at least walking every day. There shouldn't be a day where you're not at least walking. That increases your metabolism. That also helps with blood flow to the legs and to the feet because your calf is like a pump when you're walking. So it helps improve blood flow to the area. And your diet, if you're eating healthy fruits and vegetables, you're not eating as much fatty foods. People think eating a lot of cookies and candies leads to diabetes. It's not just that. It's eating a lot of fried and fatty food that can lead to diabetes also. And so when you have diabetes, that can lead to a whole lot of different issues. So eating right and exercising daily, and it can just be a walk. Lifting weights is healthy. Walking your dog, jogging is healthy. Riding a bike, swimming. Like just being active on a daily basis, mixing it up, and eating right is the best way to prevent any type of a lot of these issues because our diseases that we have that are causing these lower extremity issues are communicable diseases or diseases from non-healthy lifestyle.
All right, great information. Let me hit the high bell on that. All right, Doc, I'm not going to hold you up too long because I know you got like 50 different job titles. If you guys are in the Douglas or West Atlanta area or just in Metro Atlanta in general, make sure that you check him out at Optimum Pediatry. You can go by there. And if you have a wound, make sure that you get it checked out. And if you're in the Wellstar Douglasville area, you can check on a good doctor right there. Great person. Really, as you can see, knows his stuff. All right. Right before we get out of here, man, let me go ahead and get into our fast 4 questions. You ready to play this game, Doc?
Let's do it. I'm ready.
All right. We know you train in sunny Florida. What is your favorite thing to do down in Florida?
My favorite thing to do down in Florida is run on the beach. I love running on the beach. That is so much fun. I mean, when I was down in Florida, there's no such thing as winter or fall. So I can do this every day. So I did that before studying, after studying. I was always doing this.
I like it, man. So you a little business and pleasure when you're down there working out and having fun. I like it.
That's right.
All right, man. What was the wildest thing you've seen when it came to feet and doing your job?
Okay, so the wildest thing I see a lot of crazy things. But I'd say the wildest thing I ever seen was when I was down in Miami, when I was in my residency, I had a patient that came into the ER because a dog, an Akita, ripped off his whole calf muscle.
Wow.
A dog bit off his whole calf muscle, and I could see the nerves, I can see the leg bone, I can see the blood vessels pumping, but the whole calf muscle was ripped off by an Akita.
Wow.
And so that was the craziest thing I've ever seen. I was like, how in the world is this guy going to have a leg after that? We were able to repair his leg. We were able to put grass and things like that and give him somewhat of a calf muscle and a functional leg. That was probably the craziest thing I've seen. I've seen gangrene. I've seen all types of issues, but that was the craziest thing I've ever seen in my entire life.
Wow, that is something. That's something. I'm gonna just stick to German Shepherds, man. I don't want to even see an Akita after that story.
Yes, every time I see Akita sister, I always think about that issue. I'm like, I'm rocking on the other side of the street.
Definitely understand. All right, I know a lot of times some of our older people and younger people talk about gout, man. What is a thing that we can do to treat gout?
So, the best thing about gout is prevention. Mm-hmm. So, a lot of times patients get gout if you eat a lot of red meat, you drink a lot of wine or a lot of alcohol, you eat a lot of shellfish, things like clams, mussels, shrimp, things like if you're eating a lot of bottom feeding fish. If you're eating a lot of that stuff, that can, on a regular basis, that can lead to a lot of gout. So limit the amount of, and also dairy products. If you limit the amount of red meat, limit the amount of alcohol, limit the amount of dairy products, and limit the amount of shellfish and all that, that will pretty much keep away any gout flare-ups that you could potentially get. But the reason that back in the past that a lot of kings and things had gout, because those were expensive foods that people that weren't kings and queens couldn't get. So that's why they called it gout. But if you limit that stuff, you won't get gout.
Makes a lot of sense to me. No more clams for me.
It's very painful condition. If you get it, it's very painful. So try not to get it. And if you do get it, don't try to self-treat it with creams or anything like that. Come into a podiatrist, because it's going to take a lot of medications, injections, and right along with changing your diet. So.
Got you. Great information. All right, last question before we get up out of here. If you can go back and tell yourself anything at 18 years old, one line, what would it be?
If I could tell myself anything at 18 in one line, is enjoy the process, enjoy the education, enjoy the college, enjoy the medical school experience, enjoy residency, enjoy beginning work, because I'm always pushing myself forward. I'm always working. I'm always studying and learning. And then when I look back at it, 10 years have passed. I was like, man, I wish I would have enjoyed those little moments, because it flies by when you're so focused. And I was a very focused and driven, but I wish I would have enjoyed those little moments more.
Got you. Great information. I appreciate it. I'm going to share that with some people today. Thank you, man. I appreciate your time, man. This has been great. We've got so much good information that we're able to share with our listeners and watchers right now, and it's all thanks to you, Doc. So thank you for being part of the show today.
Thanks for having me. I love talking to people, and I hope I help you and help educate everybody else.
Oh, you absolutely did. All right, guys, we're going to get back to our mix right now, so stay tuned to Reec Radio on the streaming side. You guys stay tuned. We have a very special guest coming tomorrow, and it's somebody that you definitely want to meet. So make sure you tune in right here at 12 o'clock. This Reec Radio.